Hi, I'm Dr. Alonzo Wynn. Welcome to Health Chat. So today we're going to be talking about routine checkups, routine preventative care type things. You hear it all the time from friends, family, every place in the media, your own doctor. Don't forget to get your checkup. Have you ever wondered why? Have you ever wondered why it's important to get those routine visits? What's so important about them, and what are they checking for anyway? So that's what we're going to be talking about today. So it is very important to get the routine visits, but is it that everybody has to have that cookie cutter annual exam? Probably not. So infants are usually seen several times during that first year, usually every 2 to 4 months, so they can get all those immunizations. And then less often in the second year. But it's not just about the immunizations. It's also about a lot of other things. We check for, is the vision okay? Is the hearing okay? Are they developing like they should? Are they eating well? Are they starting to hit those what we call developmental milestones? Are they crawling around the time they should? Are they walking around the time they should? Are they talking when they should? Those kind of things. Answer any questions the parents might have about raising the child or anything like that. So those are the things that we do during the infant exams. So that's why the babies need to be seen so often, and then less often as they get a little older. Older children and teenagers do need to get seen every year. Because again, we still need to make sure that they're developing normally, that they're growing as they should, both height and weight. And then we talk about those developmental things as well. And as they get older, we talk about other things around their development, whether it's bullying in school, whether it's safer sex practices, whether it's gun safety, a lot of different things we talk about during those exams. We talk to them once a year. Now, women, once they are sexually active, they need to get their, what we call a pap smear, which is a test for cervical cancer. They need to have that every year. Once they've had at least 3 in a row that have been normal, depending on if they have any other medical issues, their doctor may say that they only need to have the pap smear done every 3 years. So men, it's a little bit different. So and again, all these numbers are talking about people who are generally healthy, don't have any other medical problems, don't have any other reason to see the doctor on a regular basis. They're not on medicine for high blood pressure, all those kind of things. So people who are completely healthy, no medical problems, not taking any medicine for anything. That's what all these numbers are talking about. So men in their 20s need to be seen twice, just kind of as a rule of thumb, so every 5 years or so. Men in their 30s need to be seen 3 times, so every 3 years or so, 3 to 4 years. And then once they hit the 40s, they need to be seen annually. Everybody, and women after the age of 65 need to be seen annually as well. So now, I touched a little bit on the vaccines that the kids get when they're an infant, but older children need vaccines as well. And so these vaccines are incredibly important. So the number one reason that we give all these vaccines is to avoid the potentially deadly diseases that are very, very serious. And a lot of these diseases had been either completely eradicated, completely gotten rid of in the United States, or almost completely gotten rid of in the United States. But over the years, as people have been less serious about getting their vaccines, or more people are opting out of the vaccines, we've seen these diseases come back. We've seen polio come back. We've seen measles come back. We've seen whooping cough come back. All these things that were eradicated or almost eradicated decades ago are now coming forward, and now they're putting people at risk. It's not only is it putting people who were not immunized at risk, it's putting people who cannot be immunized, putting them at risk as well. And the other risk for these diseases is that because they are less common, most doctors have never seen an actual case of measles or whooping cough or any of these kind of things. They learned about it in medical school or maybe residency, but they've never actually seen it. So it's harder for these diseases to get diagnosed because it's not something that we think about, because it's not something that we see typically. And I mentioned the immunocompromised people, people who have immune system problems, people who have AIDS, people who have had an organ transplant, people who are on medicine like steroids or something else that turns their immune system off because of some medical condition that's being treated. These people, they cannot get some of the vaccines because some of the vaccines are live vaccines that have just been inactivated, so they don't cause the disease, but the bacteria or the virus is still alive. And then you have some vaccines that are what we call killed. So there's no alive bacteria or virus in those vaccines. People who have a non-intact immune system cannot get those live vaccines. So that puts them at risk for those diseases. So when they can't get immunized against those diseases, their protection against those diseases is related to the protection of the people around them. It's what we call herd immunity, which means that the vast majority of people are immunized against a disease, and so it's less of that disease in the population, so it's less likely that anybody, whether they're immunized or not, will get that disease. Because no vaccine is 100%. There's always that teeny tiny little chance that even if you got vaccinated against measles, you could still get measles if you get exposed to it. So the less of the disease that is in the population, the better it is for everybody. So if you have fewer people in a population that are immunized, the more likely it is that the disease will be in the population, so that puts everybody at risk. So for example, if you have 100 people, if you have 99 of them that are immunized and one person that has an immune system problem, that one person is much less likely to get the disease because the 99 people around them have been immunized. But if you take that same one person who has an immune system problem and you surround them with 48 people who are protected but 49 people who are not, well then those 49 people could potentially get measles or whooping cough, and then that one person who could not get vaccinated is at higher risk for developing that disease. So it's important to get the vaccines not just to protect yourself, but also to protect the rest of us. So, and I've also heard some concerns about the number of vaccines and how often they're getting them, because people think, well, can't we just spread them out? You know, we don't want our baby to get 4 shots in one visit. Can't we get 2 this time and then 2 next time? The problem with that is they have done studies to figure out the schedule of these vaccines. This was not just kind of picked up randomly as far as, oh, well, let's just give these shots at this time. Now, they've done studies to determine the immune response. Because when you get a vaccine, your body develops antibodies to whatever you're getting vaccinated against. Whether it's tetanus, whether it's whooping cough, whether it's the flu, whether it's pneumonia, whatever it is, when you get that vaccine, your body develops immunity, develops antibodies for that disease. So if you happen to come across that disease in the population, your body can fight it off. So if you've gotten the flu shot and you have a coworker who has the flu, when that flu tries to attack your body has you know, the brute force got the protection saying, nope, you're not coming in here because we see you, we recognize you, we're going to take care of that, we're going to get rid of that virus. So that's how vaccines work. So when you get them on schedule, your body develops that immunity as it should. Anytime you skip a vaccine or you delay a vaccine, you decrease the response. You have less of that immunity. So because you're not fully protected, and if you have a series of vaccines, you're not fully 100% protected until you've completed the series. You have some protection, but you're not completely protected until you have finished the series. So if you delay that series out and it takes the extra 6 months, during that extra 6 months, you are still at risk for developing that disease or catching that disease. Most people don't have any side effects at all from the vaccine itself. And the more vaccines you get at one time, the more likely you are to develop a side effect from that vaccine. So the most common side effects are you have pain or redness right at the site where you get the injection, so right in the arm or right in the thigh if it's an infant, or right in the buttocks for some of them. You might get a little bit of a low-grade fever. Usually not a big deal. Most people, if you you can put a little ice on the arm if it's painful or red. You can take some Tylenol or some ibuprofen or something like that if you do have a little bit of a fever. But like I said, most people don't have any side effects from the vaccines at all. And you may have heard reports in the media about the risk of autism from the vaccines. That has been debunked. There's absolutely no scientific evidence for any of that. So there's really no reason to avoid vaccines or delay vaccines because you may have heard about a report for that. There's absolutely no science that says that autism comes from vaccines. So it's perfectly safe to give your infant those vaccines because you don't want them to develop these diseases that potentially can kill them or someone in your family or someone in the population. There are some people that cannot get vaccines. We talked a little bit about that. The people who have the immunological problems, suppressed immune system, but there are other medical issues that can make it not a good idea to get a particular vaccine. So you do want to talk to your physician about the child's history, your family medical history, and they will let you know if there's any reason that your child should not get any of those vaccines as they are recommended. So moving on to the older children and then teenagers. So again, we're still talking about growth and development, make sure they're developing normally, make sure they're growing normally, make sure they're gaining weight as they should, make sure they were growing for a while, then they stopped growing. If so, what's going on, what's causing that. The social development, like we talked about a little bit earlier, bullying, making friends, getting in the social circle, dealing with peer pressure, those type of things. A lot of times, teenagers feel a little bit more comfortable talking to a doctor, especially if it's someone that they've known the whole time growing up. They may not want to talk to their parents about it, but if they talk to their physician about it, that's still an adult as opposed to talking to their friends about it, so they can still get that same kind of positive reinforcement about anything that's going on with them. Again, they still need some vaccines. Some of them are similar vaccines to the ones they got when they were younger. Some of them are newer vaccines for different diseases that they did not get vaccinated against. And we also talk about safer sex practices as well. And again, that varies from age to age as far as when you start having these different talks. Usually in my practice, I just kind of talk to the child, see where they are in their development, and then I let that lead my guidance as far as what they need to talk about at any one time. I don't talk to them about things that I feel like they are not emotionally or developmentally ready to talk about. So everybody's a little bit different as far as when I have the safe sex talk, when I have the peer pressure talk, when I have those kind of talks with them. And you also talk to them, especially the older teens, but not necessarily the older teens, any of them really, talk about not starting to smoke, talk about not drinking, talk about exercise. If they are overweight, we talk about weight loss. And it's important that they hear this in a non-judgmental way. You don't want to berate them about their weight. And it's always a good idea that because sometimes they don't want to listen to their parents. If you're telling them, hey, you need to exercise, you need to lose weight, they don't want to hear it coming from you. But if they hear it from their doctor in a different way, they may hear the message a little bit differently. So it's always a good idea to have that kind of reinforcement where the parents are saying one thing and the doctor's saying the same thing. And so they keep hearing this reinforcement of this message over and over and over again. So eventually they kind of hear it, because sometimes teenagers don't hear what you say to them. I know that's shocking, right? So then we're going to move on a little bit older. So we're going to move past the teens. We're going to move into the adults. So why do adults need to get the routine exams? Because we're not dealing with growth and development anymore, because once you're an adult, you've pretty much done all the growing you're going to do, unless you're gaining weight and you're going out. But that's a thing we're going to talk about in a minute. And there's no really developmental milestones anymore, because once you've developed all that you're going to develop. So primarily the reason for doing the routine exams in adults is you want to check to see if there's any medical problems that are starting to develop, if there's any risk factors. So you want to do a complete history where we talk to the patient, talk about where they work, what kind of work they do, if they smoke, if they drink, if they do any kind of drugs. Any family history. Has everyone in their family had colon cancer? Does everyone, excuse me, in their family develop breast cancer? Does everyone in their family develop high blood pressure? Did both parents have a heart attack when they were 45? You know, those kind of things, because family history can increase your risk for developing certain diseases that tend to run in families. So that determines what further investigations you need to have done. If someone is 45 and they're normal and healthy and their family is normal and healthy, it's much less likely that you would need to do any other kind of heart test or anything like that. But if someone is 45 and they're normal and healthy and everyone in their family has a cholesterol that's super high and they've all had heart attacks and had to have bypasses and things like that, well, you might send them to a cardiologist sooner than someone else. So you need to have your doctor know all that family history as well as your own personal history to see what your risk factors for developing disease are. So after you've had the history part where they talk to you and they ask you a lot of questions and gather all that information about your risk factors, then they'll do an examination. Generally, if you're coming in for a routine examination, it's a head-to-toe exam. So they'll check your blood pressure to see if your blood pressure is normal or if it's high, because your blood pressure can be high and you don't have any symptoms. And so if you don't go to a physician to get that checked, you may not know. You may not know that you have high blood pressure until you wind up in the emergency room having a heart attack or a stroke because your blood pressure is really high. So it's important to get that checked on a regular basis. They typically will have you take all your clothes off so they can look at all the skin of your body, looking for any moles that look suspicious in any way. And then they may do some blood tests as well. And typically what I do and what a lot of doctors do when you're coming in for a routine physical, when they do that blood work, the things we're looking for, we check your kidney function, we check your liver function, we check your blood sugar to see if you're at risk for developing diabetes or if you have diabetes. Because again, just like with blood pressure, you could have a high blood sugar and not be having any symptoms and no one would know if they didn't check it just routinely. So we check that, we check your cholesterol, we check your anemia, and we may check other blood tests depending on your history, either your history or your family's history. And then in addition to that, we also would do just a complete exam, looking for any abnormalities, look in your eyes, your ears, listen to your heart and your lungs. We may do an EKG depending on your personal history or your family history. If you're a man over 40, we'll check your prostate. If you are a woman, we will do a breast exam. And prostate exams and breast exams are looking for lumps that are potentially cancerous. Because again, you may not know that they're there unless you have someone check. If you are a woman, you would have a pap smear that we talked about a little bit earlier. So, and again, that's once a year unless you've had several in the row that are normal, in which case it would be every 3 years. And then we would do any other screening tests for STDs if we feel like that is warranted based on your history and any concerns you might have. And adults need vaccines too. They don't need them as often as teenagers or children, but there are still certainly vaccines that adults need. The number one thing that adults need is a flu shot. Anybody over the age of 65 should get a flu shot every single year. Anybody with any type of chronic illnesses should get a flu shot every single year. And when I say chronic illnesses, I mean either lung issues like COPD or asthma, or do you have sickle cell? Do you have any type of cancer? Do you have diabetes? Any type of medical illness that puts you at risk that if you get the flu, you're more likely to develop a complication of the flu, you should get a flu shot. I encourage everybody to get the flu shot because even if you're young and healthy, who wants to be sick with the flu? And it's an easy thing to get the flu shot. The pneumonia shot is designed primarily for people over 65, but also anybody with any type of chronic illness, especially lung illnesses like COPD, like asthma. The tetanus shot, you still need to get that updated. The recommendation is every 10 years unless you have had some type of injury. If you step on a rusty nail or something like that and you're in the emergency room, they may give you an injection sooner than the 10 years. But if you don't have any injuries, your regular family doctor will want you to get that tetanus shot done every 10 years. We are giving a new tetanus shot. We've been doing it probably for about 5-6 years or so, maybe a little bit longer, where it has the pertussis in it as well, or the whooping cough. We used to give just the whooping cough to babies, and then for adults we gave just tetanus. But with the recurrence in the population of whooping cough, we started giving the pertussis vaccine to adults as well, because we've discovered that that immunity wears off over time. So if you got vaccinated when you were 2 and now you're 60, well, that immune response is not as good as it was before, so you need a little bit more of that as well. Excuse me. And then there's a newish vaccine that's been on the market for several years, but it's one of the newer vaccines we have. It's a vaccine for shingles. You've probably seen the ads on TV all over the time, all over the place. And what shingles is, just so you know what shingles is, when you have chicken pox, you don't get rid of the virus that causes chicken pox when the rash goes away. It actually moves into a nerve cell somewhere in your body, and it picks the nerve. So it moves into a different nerve cell in your body. And then years or decades later, it wakes up and it causes shingles. And so you get this rash that looks like chickenpox, but it's only in the area that is covered by that nerve. So you have a patch of chickenpox rash on one shoulder or one leg or around one eye or something like that. It's never on both sides of the body, it's other than just one place. The difference with that as opposed to chickenpox when you get it, is usually more itchy, more you want to scratch it all the time, whereas with the shingles is more painful. It may itch a little bit, but it typically is more pain than the itchiness that you get with chickenpox. So the recent vaccine will help prevent that from occurring, or if it does occur, people tend to have a less severe case of shingles if they've had the vaccine. So in addition to all the other things that we have talked about during your physical, we then also talk about any screening tests that you might need based either on your age or any risk factors, either in your history or your family history. We recommend colonoscopies. Colonoscopies are recommended starting at the age of 50 for just the general population if you don't have any risk factors. If you have a family history of colon cancer, you might need to get that sooner, which is part of the reason why that family history is so important. Same thing with a mammogram. Mammograms typically start at the age of 40, but if you are someone who has a family history, or if you have had some breast issue in the past, you might need to get that sooner than that. And then we also would recommend a bone density test. Typically we do bone density tests in women, and that's looking for osteoporosis. But some men are at risk either because of family history, their medical conditions, medications they take. They may be at risk for osteoporosis as well. So men do get those bone density tests done as well. A chest x-ray we recommend for some people. Typically that's for people who are smokers or former smokers, especially if they were heavy smokers for a long period of time. People who have risk either socially or occupationally of exposure to certain chemicals or certain pollutants in the air that may put them at risk for lung cancer or other lung issues. We also always recommend an eye exam. In general, it depends on your age, medical history, any other medicines you're on. But a good rule of thumb is even if you don't wear glasses, it's a good idea to get an eye exam every 2 years or so. If you have any medical problems that can affect your eye, like high blood pressure or diabetes, you want to get that eye test done every year. Because not only do they test for vision, they check you for glaucoma, they look for cataracts, they look in the back to look at the blood vessels of your eye to make sure those are nice and healthy. So there's a lot of things going on. So even if you feel like, well, my vision is fine, I don't need an eye exam, you still need an eye exam. And depending on if you or your spouse feel like your hearing is going low, or if during the exam the physician feels like you're not hearing well, they may refer you for a hearing test as well. Another thing that happens during the exam is we talk about what your risk factors are and ways to decrease those risks, things that you can decrease. We talk about safer sex practices. We talk about smoking cessation if you're a smoker. We talk about alcohol cessation or cutting back if that's an issue. If you are overweight, we talk about the importance of losing weight. We talk about the risks from being overweight. Talk about ways to help you lose weight. It's not just go lose weight. At least I know in my practice, I give people ideas on how to lose weight. And we talk about exercise. We talk about the benefits of exercise, whether you need to lose weight or not. Everybody should exercise on a regular basis. It helps strengthen your bones. It helps strengthen your muscles, especially as we get older. We lose our core strength, which is the lower back, and the abdominals, which are our stabilizer muscles, which are our balance muscles. So you always want to exercise regularly to strengthen those muscles so that as you get older, you're not getting frail where you're at risk for falling and injuring yourself, potentially breaking a bone, things like that. So as you can see, there's a lot that goes on during those annual physicals. It's not just a social call where you go in and chat with your doctor for 20 minutes or so. It really is an important part of your health care. It really is something that can catch anything that's going on, catch anything that you may not even have any symptoms of. If you do have symptoms that you don't think are important, if you mention them to your doctor, they may think it's more serious than you do, and they may order some additional tests to determine what the cause of those symptoms are. And then they work on decreasing those risk factors so that you don't develop any disease. So even if you don't have anything going on now, if they identify those risk factors, they can potentially decrease your risk for developing disease in the future. So regardless of your age, whether you feel like you're completely healthy and don't need to see the doctor, I hope today has shown that you really do need to see your doctor on a regular basis. It does not have to be every year, but you do want to do it on a regular basis so that your doctor knows you, knows what's going on, and if there's anything that starts to develop, they can catch it sooner rather than later, because you don't want to catch it too late, because then it may be harder to treat if it is treatable at all at that point. So being on top of your health is always a good idea. It's always better to catch things sooner rather than later, and stay healthy rather than try to get healthy again. So work on those, these help you work on those healthy habits as well. And make sure that make sure you're up to date on all your vaccines, all those screening tests, everything that you need to keep yourself healthy. So that's it for today. I hope this was helpful. I am Dr. Wynn. I'll see you next time.